Hello, my name is Chris Mattix, and I will be talking about ketamine treatment for depression. Before we get into what ketamine is, we will talk about the mental illness it is being used to treat, and that is depression. Depression is a mental illness that affects millions of people every year. It is classified by the following group of symptoms: depressed mood, loss of interest in activities, sleep issues, fatigue or lack of energy, loss of motivation, suicidal thoughts or actions, hopelessness and helplessness, poor concentration, or weight loss or weight gain. And generally, patients must experience at least 5 of these symptoms to meet the criteria for a depression diagnosis. However, these are not all of the symptoms a client may have, and they may experience these symptoms at different times. The important part is that they are experiencing multiple of them over an extended period of time. There are multiple diagnoses involved in depression, often classified by severity and frequency. Major depressive disorder is thought to be the most severe, but there are other diagnoses, including dysthymia and seasonal affective disorder. While not considered a depression diagnosis, mental illnesses like bipolar 1, bipolar 2, and cyclothymia all incorporate depressive episodes in their symptom profile. However, these diagnoses also feature mood swings from depressive states to manic states and are classified by the severity and range of cycles. The source of depression is highly debated, as there are thought to be many causes. Most notable theories focus on either an abundance or deficiency of specific neurotransmitters such as serotonin, dopamine, glutamate, and neuroepinephrine. Another notable theory focuses on brain structure and suggests that lower neural activity in specific areas can cause depression. This is the basis for TMS, or transcranial magnetic stimulation, which focuses on using magnetic fields to stimulate those areas of lower neural activity and hopefully increase the neural activity. While these are the most popular ideas surrounding depression, there are many other things that can contribute to a depressed mood, such as poor diet, lack of exercise, trauma, certain medications, and even seasonal changes. And that goes back to seasonal affective disorder, which is usually seen going into the fall and winter months we're about to go into now. Ketamine is a unique drug in that it falls under multiple drug classes. It is most commonly used as a general anesthetic, but is also classified as an MDMA receptor antagonist, a dissociative hallucinogen, an analgesic, and an antidepressant. And while ketamine has multiple classifications, it has only been approved by the FDA for use as an anesthetic. All other uses for ketamine are off-label or recreational. However, this does not mean that ketamine is not effective in uses other than as an anesthetic. It just means that there has not been conclusive evidence of its use in other indications. While the true mechanism of action for antidepressant effects is unknown, ketamine is used for treating depression under the glutamate theory of depression. Simply put, this theory is that glutamate is thought to have some role in causing depression, and ketamine inhibits the production of glutamate. And this is different from an SSRI, and that instead of blocking the reuptake of a neurotransmitter, it is thought to limit the production of the neurotransmitter. Ketamine is thought to affect many receptors in the brain, from the opioid receptor to NMDA receptor to AMPA receptor. And based on it affecting multiple receptors, it's kind of hard to nail down exactly how it works, but it seems to work, and that's really what matters here. Ketamine can be administered in a number of ways, and it is often marketed under different names depending on the route of administration. Notable brand name ketamine drugs include Spravato. This is ketamine delivered through a nasal spray, also called S-ketamine. This is only prescription use that is available to clients via their pharmacy with a prescription from their doctor. Ketelar is the injection, often used for an anesthetic, but also used in clinical settings for depression. And then when used in a recreational setting, it is often referred to Special K or K-hole. In a recreational setting, the doses are likely to be higher because the ultimate goal is to achieve that hallucinogenic or psychedelic effect. Now, that psychedelic effect can be experienced in a clinical setting as well, but there are some things put in place to minimize that as much as possible. As previously mentioned, ketamine has many routes of administration. As such, different routes offer considerable differences in the onset of action. When taken intravenously or via an IV, usually only takes a few seconds. In an injection like an intramuscular, 1 to 5 minutes, subcutaneous, 15 to 30 minutes, insufflation or nasal inhalation like Spravato, 5 to 10 minutes, or taken orally by mouth, 15 to 30 minutes. And while different routes of administration have different durations of action, ketamine generally has a half-life of 2 to 3 hours. Some notable differences in duration are intramuscular at 30 minutes to 2 hours, insufflation 45 minutes to an hour, and by mouth 1 to 6 hours. And based on those differences in half-life and duration is kind of how they decide which ones are going to be used in a clinical setting, which is why you see more intramuscular, IV, or insufflation, as they're looking for a 1 to 2 hour onset of treatment versus by mouth 1 to 6 hours, which is not extremely clinically friendly. Based on the wide range of duration times, it can be hard to determine how quickly a client will notice results, but typically the change is seen almost immediately or at least within a few hours. Common side effects of ketamine include confusion, hallucinations, dizziness, disorientation, disassociation, sedation, and increased blood pressure. While rare ketamine-induced psychosis can occur in clients with pre-existing psychiatric conditions, use of caffeine, alcohol, or other recreational drugs can significantly increase the likelihood of serious side effects, and ketamine should not be taken with benzodiazepines, anticonvulsants, or non-SSRI antidepressants, so like SARI or NDRIs. Some other important information. In a clinical setting, ketamine is often taken with a low dose of clonidine. That's usually used to counteract the increase in blood pressure, but has also been shown to decrease some of the hallucinogenic properties of ketamine. While there can be a risk of overdose, it is much more common when taken recreationally. Overdoses often include risk of seizure and trouble breathing. High recreational doses can cause psychedelic effects such as an out-of-body experience and hallucinations. Taken in a clinical setting, precautions are taken to ensure that the client is given an appropriate dosage based on body weight. This significantly decreases the risk of overdose. Treatment protocols for ketamine further reduce risk of overdose or withdrawal due to the length of time between treatments. And blood tests are usually not necessary due to the short half-life of ketamine. Other things in consideration there, in a clinical setting, it is not taken multiple times a day or multiple days in a row, usually weeks or at least a week in between each treatment, so that very significantly decreases the chance of overdose. And with the short half-life, again, blood tests are not really necessary. So in conclusion, ketamine is considered a new and unconventional treatment for depression. Due to the absence of FDA approval, ketamine treatment for depression is considered off-label. However, it has shown great promise in minimizing depressive symptoms without the consistent side effects of antidepressants. This is not to say ketamine does not carry risk, but due to the environment it is administered in, the risks are slightly lower than when taken recreationally. Ketamine should not be taken outside of a clinical setting, as there is no guarantee of the quality or strength of black market ketamine. And that concludes this presentation. Thank you.